Patient position, supine, hand placement and procedure. Using top hand, hold the hand and lower hand grasp the elbow and lift the patient arm through available range and return. Patient position, supine, shoulder at the edge of the bed, slightly flex elbow. Hand placement and procedure, upper hand placing the scapula to stabilize scapula and lower hand placing the wrist and hyperextend patient's shoulder. Patient position, supine, hand placement and procedure. Using top hand, grasp patient hand. Using lower hand under the elbow, move the arm out to the side. May elbow may flex.
Shoulder internal and external rotation. Patient position, supine position. Arm is abducted 90 degree, elbow flexed 90 degree, and the forearm is neutral position. PT's hand placement and procedure. Upper hand placement is grasping the patient's wrist with index finger between the patient's thumb and index finger. Place the thumb and the rest of your fingers on either side of the patient's wrist to stabilize. The lower hand stabilizes the elbow, and the direction is rotate the humerus by rotating the forearm. Shoulder, horizontal abduction and adduction. Patient position, the shoulder at the edge of the table with arm either flexed or abducted 90 degree. PT's hand placement and procedure. Using the top hand, cross over and grasp the patient's wrist and palm, and the lower hand grasp patient under elbow. Move the arm out to the side. The elbow may be flexed, which the hand placement is the same as with flexion, but turn your body and face the patient head as you move the patient's arm out of the side and then across the body. Scapula, elevation, depression, protraction and retraction, and upward downward rotation. The patient position is prone, with arm at the side or side lying facing toward the PT. Drape the patient's arm over your bottom arm. Hand placement and procedure. Cup the top hand over the acromion process and place the other hand around the inferior angle of the scapula. For elevation, depression, protraction, and retraction, the clavicle also move as the scapular motion are directed at the acromion process. For rotation, direct the scapular motions at the inferior angle of the scapula while simultaneously pushing the acromion in the opposite direction to create a forced couple turning effect.
Patient position, supine, hand placement and procedure. Using top hand, grasp patient hand and to control patient pronation and supination of the forearm and lower arm grasp patient under elbow, then flex and extend patient elbow. Patient position, supine at the edge of the bed. And hand placement and procedure. Using top hand, pronate the patient forearm by grasping wrist and extend the elbow, and lower hand support the elbow. Then hyperextend the shoulder to the point of tissue resistance in the anterior arm region. Patient position, seating, hand placement and procedure. Lower hand fully flex the patient elbow on the distal forearm. Top hand flex the shoulder by lifting up the humerus on under the elbow. Then, full available range is reached when discomfort is experienced in the posterior arm region.
Forearm, pronation and supination. The patient position is supine. Hand placement and procedure. Grasp the patient's wrist, supporting the hand with the index finger and placing the thumb and the rest of the fingers on either side of the distal forearm. Stabilize the elbow with the lower hand. The motion is rolling of the radius around the ulna at the distal radius. Wrist, flexion extension, and radial ulnar deviation. The patient position is supine. Hand placement and procedure. For all wrist motion, grasp the patient hand just distal to the point with the upper hand and stabilize the forearm with your lower hand. Note that the range of the extrinsic muscles to the fingers affects the range at the wrist if tension is placed on the tendons as they cross into the fingers. To obtain full range of the wrist joint, allow the fingers to move freely as you move the wrist. Hand. Cupping and flattening the arc of the hand at the carpometacarpal and intermetacarpal joints. The patient position is supine. Hand placement and procedure. Both hand to patient palm and thinner eminence on the posterior aspect. Roll the metacarpals palmarward to increase the arc and dorsalward to flatten it.
Patient position, supine, hand placement and procedure. Lower hand stabilize proximal bone with index finger and thumb. Upper hand move the distal bone with index finger and thumb. Or you can move all the metacarpophalangeal joint of 2 to 5 digit. Depending on the position of the patient, stabilize the forearm and hand on the bed or table. Patient position, supine, hand placement and procedure. First, we need to extend the distal interphalangeal and proximal interphalangeal joint using upper hand to stabilize and hold them, and using lower hand extend MCP, or you can move all the metacarpophalangeal joint of 2 to 5 digit. Patient position, supine, hand placement and procedure. Lower hand stabilize wrist. Upper hand move the distal interphalangeal joint and stabilize it. Then move the proximal interphalangeal joint. Hold both these joints at the end of the range. Then move the metacarpophalangeal joint at the end of available range. Stabilize the finger joint and begin to extend the wrist. When patient feels discomfort in the forearm, the muscles are fully elongated.
Combine hip and knee, flexion and extension. Patient position is supine with slightly flexed knee and hip. Hand placement and procedure. Upper hand support and lift the patient's leg with the palm and fingers under the patient's knee and the lower hand under the heel. Swing the knee toward hip flexion. Hip, extension and hyperextension. The patient position is side-lying with slightly flexed knee and hip is extend. Hand placement and procedure. Elongation of the two-joint hamstring muscle group. Patient position is supine. The hand placement and procedure. The lower hand is under the patient's heel and the upper hand across the anterior aspect of the patient's knee. Keep the knee in extension as the hip is flexed. Note, if the hamstrings are so tight as to limit the knee from going into extension, the available range of motion of the muscle is reached simply by extending the knee as far as the muscle allows and not moving the hip.
Patient position supine. Hand placement and procedure. When prone, stabilize the pelvis with the top hand and flex the patient knee until tissue resistance felt in the anterior thigh, which means the fully available range is reached. Patient position supine, hand placement and procedure. Upper hand support the patient leg under the knee and lower hand under the ankle. Keep the patient hip and knee in extension and neutral to rotate as abduction and adduction are performed. Patient position supine, hand placement and procedure. With the hip and knee extend, upper hand grasp under knee and lower hand under the ankle. Roll the thigh inward and outward.
Ankle dorsiflexion. Patient position is supine. The hand placement and procedure. The upper hand stabilize around the malleoli, and the lower hand to patients and place the forearm along the bottom of the foot. Push the calcaneus with the thumb and fingers while pushing upward with the forearm. Note, if the knee is flexed, full range of the ankle joint can be obtained. If the knee is extended, the lengthened range of the two-joint gastrocnemius muscle can be obtained, but the gastrocnemius limits full range of dorsiflexion. Ankle plantar flexion. Patient position is supine. The hand placement and procedure. Lower hand support the heel and place the top hand on the dorsum of the foot and push it into plantar flexion. Note, in bed-bound patient, the ankle tends to assume a plantar flex position from the weight of the blankets and the pull-up gravity, so this motion may not need to be performed. Subtalar or lower ankle joint, inversion and eversion. The patient position is supine. Hand placement and procedure. Lower hand place the thumb medial and the fingers lateral forearm on the foot. Upper hand stabilize around the malleoli. Turn the heel inward and outward. Note, supination of the foot may be combined with inversion, and pronation may be combined with eversion.
Patient position supine, hand placement and procedure. Lower hand stabilize the patient heels, upper hand grasps around the navicular or dorsum of the foot, then gently rotate the midfoot by lifting and lowering the arc. Patient position supine, hand placement and procedure. Lower hand stabilize the bone proximal to the joint and move the distal bone with upper hand. The technique is same for ROM of the finger. Several joints of the toes can be moved simultaneously if care is taken not to stress any structure. Patient position supine, head at the end of the bed. Procedure. Both hands on the occiput. Lift the head, chin, tuck to flex the head on the neck. Then continue to flex the cervical spine and lift the head toward the sternum.
Extension, backward bending or hyperextension. The patient position is either supine, seat, or prone. The hand position is on the occiput. The procedure: support head while doing hyperextension or backward bending. Lateral flexion or side bending and rotation. The patient position is supine. The hand placement and procedure: one hand is on the occiput and the other hand is on the side of the patient head. Maintain the cervical spine neutral to flexion and extension as you direct the head and neck into the side bending. Approximate the ear toward the shoulder, and rotate from side to side.
Patient position supine, hand placement and procedure. Bring both the patient knee to the chest by lifting under the knee. Upper hand is put under the foot, lower hand under the thigh. Stabilize the feet using upper hand and flex the knee and full flex hip papunta sa may chest. Patient position, prone, hand placement and procedure. With the hand under the thigh, lift the thigh upward until the pelvis rotates anteriorly and the lumbar spine extends. Position of the patient, hook lying with hip and knee flex and resting on the table. Hand placement and procedure. Upper hand sa may deltoid, then push the patient knee laterally using lower hand in one direction hanggang ang pelvis on the opposite side lumabas or lumagpas sa treatment table. Repeat in opposite direction.